What's up, everybody? You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and I have on with me today Rehab to Perform physical therapist and director of clinical excellence, Dr. Corey Jones. And Corey's going to talk to us about upper extremity return to sport testing and things to keep in mind as we are working to get an individual from day one all the way back to throwing. And this is not an exhaustive list that we're going to cover. But ideally, you can listen to the different buckets and categories that we're going to talk about and then figure out, based off the athlete you have, their clinical scenario, what sport demands they have on top of throwing, their age, their competition level. You may need to go a little bit more or a little bit less in depth with all this. So, Corey, early on, what are some things that we want to check off with these athletes?
Yeah, so the biggest thing in that earlier phase, and it definitely should be clear before return to sport, is just your symptom profile. There should be no neurological aspects, especially with that deceleration or follow-through component. All of your symptoms as far as pain goes should be gone. Maybe they get a little tired with some of your workouts, but honestly, the pain should be gone. One of the biggest things we tell even youth athletes is if there's pain, you should not be throwing. So it's really, really helpful to make sure that when we are trying to discharge somebody, that's a big thing. And then in the same vein, range of motion. So one of our biggest things that we're zeroing in on is limb symmetry. In the past, they permitted unilateral athletes to have a whole lot of asymmetries because they're like, hey, baseball, tennis, these people are moving their dominant arm in a very different way. But the more and more they do research, they are expecting a 95% symmetry rate, even in range of motion, even in internal rotation, because we know there's a little bit of that GERD situation happening with some pitchers. But there should still be this really solid symmetry side to side. So making sure that we really are picky about that and we're willing to put in the effort and time to really get that range of motion back.
Awesome. So now we have an athlete. They're asymptomatic or they have a very, very predictable low symptom profile. Range of motion's ideal. Now we're starting to think about strength. And there's a lot of different ways that you can categorize strength. And depending on if somebody is 3 weeks out from a surgery versus 3 months out from a surgery, you may have different things in mind in regards to what you're looking for. For these athletes, how do you categorize strength and power testing for them? Or how do you keep it straight in your head what you're trying to achieve?
Yeah, so I think the big thing is just the 3 categories that you would train them in. So those 3 categories are traction, closed kinetic chain, and open kinetic chain. So whenever you're doing the strength testing, you're doing the same thing. So some of your open kinetic chain obvious ones might be your isometric testing, so your Tyndek or grip strength type testing, because we do want to see those progress. And again, you're looking at limb symmetry and you're looking at some of those strength ratios, right? So like for a shoulder, we want to see that IR-ER ratio to really solid. So we're looking at 1/3 of the other. We're looking at limb symmetry. We're looking at different positions as well. So IR-ER, we want to look in neutral. We want to look in 90 degrees of abduction and 90 degrees of flexion. So that we're seeing these different various postures of the shoulder and we're assessing in different positions. So open kinetic chain might look a little bit like that. You can even add in an overhead press if you want, or even the PES endurance test, which is just a prone stability test and you're holding a weight as long as you can. Those things are all open kinetic. So we really want to make sure we hit that open kinetic box, especially because that's how you're using the arm in these throwing athletes anyway. But we also want to know that the shoulder can tolerate load, right? So closed kinetic testing is going to be important there as well. So you have any kind of plank variety, as long as it's consistent, standardized, and you can reproduce it session to session, you can test that as well. So one of the ones we use a lot at R2P is the hand tap test. So you're just in a plank and you're tapping the other hand as many times as you can for 30 seconds. That's a really helpful one for us. So making sure there's some weight bearing sides. I really like to go into some single arm stuff as well. So that might be some of your testing where you're doing a box windmill or some variety of that, where they're proving I have control in a rotatory plane and in this closed kinetic chain. And then the last one, you're talking about traction varieties. So as far as the shoulder goes, that's really important because of that decelerative phase of throwing. And so that could look like a cable row where you're looking at the tolerance to that follow through. It could look like a hang test. 60 seconds is normal with the double arm, 20 seconds is normal with that flexed arm hang. Or it could look like once you start leaning into power, traction actually might look like a ball throw. So here at R2P, we do a seated shot put test and a seated chest pass with the med ball. And we're looking for distances on those to see, can the arm tolerate the traction aspect of the follow through of a throw? So really pertinent to make sure we're seeing progressions and getting to, again, a really solid limb symmetry, and also a non-symptomatic traction test, closed kinetic test, and open kinetic test.
Now, when we get through all of that, eventually we have to start thinking, all right, we have good range of motion, we have good strength, we're getting closer and closer to throwing, but we still need to bridge this gap towards throwing. What have we not looked at yet, either from a testing standpoint or informally, just with exercise, to bridge the gap before we get into an interval throwing program?
Yes, I would say two things. One might be impact. So can I actually tolerate impact to the shoulder? So that might be catching. So either catching yourself from your knees, lateral catch to the wall is sometimes another one that we test. So some sort of impact, some sort of contact, especially this is important, obviously, once you get to football players. Is this something that they can tolerate? Basically accepting a little bit of that load. And then endurance as well. So let's say we have a plyometric ball toss or a ball flip, something like that. Can I do it consecutively, time and time again? Just thinking of the number of throws that an athlete goes through with practice or in a game. So really trying to make sure that we're testing the volume that they're doing so that it's not just like, oh, you can do a therapy session's worth, but we've actually looked at the numbers and looked at the volume load, and we can actually mimic that to look more like the sport itself. So it's really important that, yes, we're doing some of these tests in isolation, but we also have to do some of these tests either in a fatigue state or we have to do some of these tests as the athlete has progressed through to make sure that they can actually tolerate the actual volume they need. One of the best ways to do that is a throwing program, right? So if you can work somebody up from initiating a throwing program all the way to the very end, again, throwing programs are very symptom oriented. As long as you're having no pain, you're able to progress to the next step. So a great way to increase volume is a throwing program, just making sure we're getting back to that. You can mimic that in any other thing that you need to as far as an upper extremity goes. If I need to do a certain number of Olympic lifts in a training session, that's the volume I'm working up to. If I need to do a certain number of swings, either batting or in tennis or some version of that, make sure we're working up to that volume. So it is helpful to talk to coaches at that point or the athletes themselves to know what the expected rep count might be so that we're making sure that they can tolerate that. And then also basically backwards reverse engineering to say, how do we make this a slow progressive overload rather than something we're just throwing them back into? So really helpful, I think, to make sure that we're looking at overall volume in return to sport too.
And I think when you look at all of this, it's really simply, do they pass standard orthopedic testing? All the stuff we learned in PT school, basic first, second year stuff, does that look good? Then after that, we need to take a little bit step further. So now when we start looking at strength, we need to figure out how does strength look in different environments, like you alluded to, traction, compression, open chain, closed chain. How does it look at from an isometric standpoint? And do we have some normative data, benchmarks in relation to the individual's body weight or in relation to other planes of motion or the contralateral limb? We can also look at just age-related norms or demographic-related norms. Then when we get into some of our other activities, it is, can we mimic the demands of throwing from a plyometric standpoint, either with repetitions, with speed, with impact or contact, whatever that looks like. And I like to look at a lot of those as like anterior and posterior shoulder stress. So if we're doing like a wall dribble test, that may be a little bit more anterior shoulder. If we're doing a 90-90 ball drop or we're doing a prone cuff endurance test, that's going to be a little bit more posterior shoulder. So it's nice to keep that in mind. And are we working with a certain type of injury that lends itself to being more anterior, posterior in nature? Or are they complaining of discomfort at different phases of throwing? And do we need to revisit one of those tests? So,
right.
Corey, I appreciate all the thoughts on this. If you work with athletes, hopefully this gets your head spinning a little bit in regards to where to start with them from a return to throwing standpoint. And if you have anything else that you have found useful, feel free to reach out, comment. Let us know what you do with your athletes, what you've had success with. And if you've enjoyed this episode, please share, like, and subscribe. You're listening to the Strength and Knowledge Podcast. This is Dr. Zach Baker and Dr. Corey Jones.